Every medical breakthrough, public health policy, and clinical research study relies on one essential tool: biostatistics. Simply put, biostatistics is the application of statistical methods to health, medicine, and biological sciences. It helps researchers transform raw data into meaningful evidence that can improve patient care and guide healthcare decisions. Imagine conducting a study on a new treatment. Collecting data alone is not enough. Researchers need to know whether the results are genuine or simply due to chance. This is where biostatistics plays a crucial role. It helps in designing studies, selecting appropriate sample sizes, analyzing data, and interpreting findings accurately. Some of the most common concepts in biostatistics include measures of central tendency, such as the mean, median, and mode, which summarize data. Researchers also use measures of variability, like standard deviation, to understand how data is distributed. These basic tools provide a clear picture of the characteristics of a study population. Another important concept is hypothesis testing. Researchers often compare groups or treatments to determine whether observed differences are statistically significant. The p-value is commonly used to assess whether a result is likely to have occurred by chance, with a value below 0.05 often considered statistically significant. Biostatistics is also essential for understanding relationships between variables through methods such as correlation and regression analysis. These techniques help researchers identify risk factors, predict outcomes, and support evidence-based decision-making in healthcare. In today's data-driven world, biostatistics is far more than just numbers and calculations. It is the foundation of reliable medical and health science research. By understanding the basics of biostatistics, researchers can draw accurate conclusions, make informed decisions, and contribute to the advancement of healthcare and scientific knowledge.